right, James, welcome over to the office.
Thank you.
I just spoke with our receptionist. I had a look at your x-rays and everything looks okay. I'm just gonna place a little sterile cloth there. Everything looks good on your x-rays as far as I can tell. I have a couple questions, so I'm gonna start with just a general inspection, and do you mind answering some stuff about your health history?
Sure.
Okay. So I'm gonna have you close your eyes just because I do have a light and it's a little bit bright. Just having a look at your mouth area. So when was the last time you were at the dentist?
It's been a little over a year now.
Okay. And was that just for like a general checkup, or
Yeah,
were
it
you
was
having...
just for a routine exam.
Okay. Just gonna be moving around your nasal area, having a look at your maxillary sinuses. Have any pain or feel pressure as I do this?
No, I don't.
Okay, and I didn't see any new developing cavities on the x-ray. Do you have any cavities older than 10 years that you had treated?
No, I don't.
Okay, so not prone to cavities really at all.
No. I only have one ever.
Looks like you had your wisdom teeth removed.
Yes.
Were you having any issues with that? Or
No,
was it just recommended when you tried it?
It was just time.
Yeah. It's not really a thing anymore, but it was common a while back for dentists to recommend having your wisdom teeth removed around 18. It was thought that they can cause issues later on in life, but we don't really find that that's necessary nowadays as long as you're getting your teeth checked routinely. Okay, and can I have you open your mouth for me? Just open and close. Okay, do you ever notice any like issues with TMJ or clicking? Do you hear clicking at any point? No clicking. And you don't feel anything like your jaw locking when you open and close?
No, I don't.
Okay. I'm gonna set this down, and can I have you open for me? Just running along your mandibular bone. Do you feel any pain with this palpation? Okay, go ahead and close. It's gonna be a little uncomfortable. I apologize. I'm just having a feel for your actual jawbone. Pull your upper. And your lower. Underneath. Can I have you keep your mouth closed and lift your tongue to the roof of your mouth? Okay, you can relax. Clench for me. Again. 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 Okay, no issues there. Feeling normal tension on either side. Sometimes there are issues with one side being a little stronger than the other, but I'm not sensing any of that for you. Okay, so I'm going to just check your temperature really quickly. Can you open your mouth for me? Lift up your tongue. Go ahead and close. Okay, 98.6, which is perfectly normal. Alright, so the next thing I'm going to do is check the reflexes in your jaw. So I want you to just kind of relax. Don't try to hold your mouth closed or open it. Just let it sit naturally as it would, okay? You're just going to feel a little slight palpation on your jaw. Again, just checking for any issues with TMJ, or sometimes can detect early lockjaw based on your reflex. Go underneath a little bit. Okay, no issues that I'm seeing there. Check your reflex one more time. Something just a little bigger. So I want you to open your mouth this time and just kind of let your jaw hang. There you go. Keep it open for me. Okay. Any pain with that?
No.
Okay. Let your mouth hang open, keep it still. Okay, very good. So I do want to check just for general sensation in your face, mainly around your jaw area.
Okay.
So I have a couple different things here. Can you feel that this is pretty sharp and this is pretty dull?
Yes.
Okay. So I just want you to close your eyes for me. Tell me if you feel sharp or dull, okay?
All right. Sharp. 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 Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp.
Okay, very good. No real issues with that. So your sensation seems to be okay. So let's go ahead and move in a little closer. I have my loops here. It's basically just a magnifying glass with the light on it. Do you recommend keeping your eyes closed? It is pretty bright. So tilt your head back just a little. There we go. I'm gonna have you open your mouth. Can you stick your tongue out for me? Okay, and relax it back in your mouth. I'm gonna have a look at your lips up close. Moving your lip, having a look at your bottom teeth. Going with my regular light. And actually, use this one. Just having a look on the surface level. Okay, so I'm gonna go ahead and put on a pair of sterile gloves. And this is the part where I will actually be putting my fingers and different instruments inside your mouth, okay?
Okay.
So I'm gonna take these off. Apply a little bit of sanitizer. I have my sterile gloves here. I'm gonna use you as a table if that's okay. Okay, so like I said, I'm actually going to be inserting my fingers and a couple tools into your mouth. Let me first just open up this gauze. Okay, so I have some gauze here, and I'm just going to be using this as a tool to help me maneuver. Can I have you stick your tongue out for me? This might be a little uncomfortable. I'm going to use the gauze to hold your tongue and move it. So try to relax for me. Stick it out as far as you can. And just because the tongue is wet, obviously the gauze makes it a little easier for me to be able to move it from side to side. Looking under. Having a look at your taste buds. Not seeing any fissures. It doesn't look like you have a geographical tongue. Taste buds appear to be normal. Okay, sorry for that. Okay, so just my tongue depressor here. I'm gonna have you stick your tongue out again. This is just gonna help me push it down. Up to the roof of your mouth. Okay, you can relax your tongue. Good. Very good. Can I have you open your mouth for me? Okay, you can relax for a second. I'm going to start by actually having you open your mouth for me as far as you can. I want you to bite down on this bite block. And I'm going to just have a little bit of a better look at this side. Your teeth actually look really healthy. Do you brush twice a day?
Mm-hmm.
Okay. I'm gonna switch this over to the other side. And how frequently do you floss? Are you flossing at least once a day?
Mm-hmm.
Okay. I do see that old cavity that it looks like was filled. Okay. Okay, we can let this go. I know the bite block's a little uncomfortable. I apologize for that. Okay. So I'm gonna use this to agitate your gums a little bit. It's just a silicone scrub. It has two different sides. One of them is a little more scrubby than the other side. I'm just trying to agitate the skin on your gums to see if there are any abnormalities. Is this painful?
Mm-mm.
Okay. Using this to agitate the skin on your lips to see if there are any lesions or abnormal texture, but everything looks pretty standard. Skin looks pretty healthy. Okay, so the receptionist let me know that you tend to be sensitive to pain at the dentist. Is that correct?
Yes.
Okay. So I do have a little bit of lidocaine that I can give you before we start with the more invasive part of the exam. Is that something that you'd be interested in?
Yes, please.
Okay. So before we do that, I'm just gonna have a listen to your jaw. Okay. So just breathe normally. I'm just listening to your jaw. Making sure we have adequate blood flow. Place it on your temples. Lastly, on your cheeks. Okay. Everything sounds normal and healthy there. So let's go ahead and administer the lidocaine. Just gonna draw it up in my syringe. And I'll only be giving you about 3 cc's, which is just enough to numb the area. Feeling okay? Comfortable? Okay, well, I have an exposed needle here, so just try to sit still for me. I'm gonna go ahead and release. So I'll have you open your mouth for me. Okay, and I'm just gonna be injecting couple cc's here, so you're gonna feel a sharp poke. I'm gonna be moving in and out kind of quickly, which tends to help lessen the sensation of the needle. You feeling okay? Okay, we're almost done. I'm gonna do a little bit on the inside here. Okay, and then one more here. Okay, I'm sorry about that. Feel okay? Okay. All right, so let's give that about 10 seconds to kick in. In the meantime, I'll go ahead and grab the tools that I'm working with. You should start to feel the numbing happening pretty quickly. Okay.
Mm-hmm.
Starting to kick in.
Mm-hmm.
Do you feel like it needs another 10 seconds or so?
Mm-hmm. I think it's okay.
Okay. So I'm just going to test one out here. Does this hurt?
No.
This feels okay?
Yeah.
And this feels okay.
Mm-hmm.
Okay, we should be good to go. So I don't want you to be alarmed. I have a little silicone bit here. This is just going to help me hold your lip open, okay?
Okay.
So what I'm going to do is go in and just use my tool. You can look, it's just a sharp tool. I'm not going to be like poking you or puncturing you. I just want to test your teeth to see if any of them hurt, okay?
All right.
So as I do this, I'm just going to go down the line. Just tell me to stop or say, yes, it hurts or whatever if we hit one and it's painful. All of this okay?
Mm-hmm.
Okay. Open your mouth for me. I'm going to do the same thing. This time I'm just going to go on the flat surfaces. Any pain here?
Mm-hmm.
And no pain with any of this.
Mm-hmm.
Okay, good. Now that we've done that, the next thing I want to do is let's see. So I'm gonna go in with this. Use my light, and I have what looks like a very odd-looking pair of tweezers,
Mm-hmm.
and I'm gonna use this to kind of grab your teeth. Okay, this just helps me test and grade the enamel. So I'm mostly going to be doing these on the front teeth. So enamel is kind of like the filling inside your teeth. Picture your teeth as being hollow. The stuff inside is enamel. So enamel erosion. It's less common maybe than it used to be, given that there's fluoride in most modern day tap water and toothpaste. But it's still important that we check. And it tends to run out a lot more quickly in these front teeth just because you're eating and drinking and using these teeth, and things with a lot of acidity can tend to wear away at our enamels. That's why it's so important to brush your teeth, especially if you're drinking a lot of juice or coffee or tea. Any of that causing you any pain?
No.
Okay. Another tool here. Very similar. As I put it behind your tooth and to shine the light, it really shows me if there are any enamel deficiencies. And unfortunately, the thing about enamel is that once it's gone, there's no way to get it back. So we can do things to protect the enamel that you have, but essentially once you have enamel loss, there's really nothing we can do. Okay, very good. So I'm going to test a little bit of jaw strikes, and I have a bite block here. This is also going to help me hold your mouth open. So I'm going to have you open your mouth, bite down. Don't let me pull this out, okay?
Mm-hmm.
Okay, open, bite down. Don't let me pull it out.
Mm-hmm.
We'll do this side, open, bite down. Very good, open, bite down. I'm gonna do it in the middle. Bite down. Very good. And bite down. Go ahead and open. Very good. No issues with pain?
No.
Okay, perfect. This also gave me a little
Imprint.
imprint of your teeth, which helps me look at the alignment, and you have perfect crescent moon, so your teeth are very straight. There's none that appear to be any shorter than the other. So I'm gonna have you open one more time. Trying to go to your molars. Bite down as far back in the back of your teeth as you can. There you go. Hard, hard, bite, bite, bite. Okay, let go. Very good. Okay. So no issues that I'm seeing there. So we're gonna go ahead and go into some routine maintenance if that's all right with you. First time guests get a free cleaning. Lucky you. So just turning on my loops here. And I have a couple different varieties of cleaning tools that I'll be going in with. Some of them are more comfortable than others, so I do apologize. People don't love going to the dentist. Okay, so let's start with this. Got my gauze. And I'm gonna move these guys in case I need them. Ooh. Okay. Okay. You okay? Tired? Okay. So I want you to open your mouth for me. We're gonna go ahead and start the cleaning. I'm seeing a little bit of plaque buildup here. Let me know at any point if I'm hurting you. Doing okay?
Mm-hmm.
Okay. A little tiny gap in your front tooth. Has it always been like that?
Mm-hmm.
A little bit of plaque up on this front tooth. Just relax your tongue for me. Okay. Very good. Not very much there at all. So the note I got from your receptionist was that you have some issues with teeth grinding. Is that correct?
Yeah, that's true.
Okay. Is it like in your sleep, or can you describe that a little more for me?
Yeah, I definitely sometimes wake up with sore teeth from grinding throughout the night.
Okay.
And then sometimes throughout the day, I catch myself doing it.
Okay, so you can feel when you're doing it.
Yeah, I can.
Okay. Does it give you a headache or any? Do you have any pain here at all throughout the day?
At the moment, no, but sometimes I do have a little bit
Sometimes
of pain.
you do.
Yeah.
When you have pain, where in your face is it usually? Like more in the jaw here?
Yeah, it's like on the lower jaw towards the
Okay.
back.
So down here.
Yeah.
Okay. And does it wake you up out of your sleep? Or
No.
okay.
No.
So it's not that severe, but you do notice it from time to time.
Yeah, I do.
Okay. And then pain is kind of in this area.
Right.
So the problem with teeth grinding is that you have like a protective coating on your teeth, right? So picture two flat boulders. They're not so flat because they have ridges, and when you kind of rub them against each other, it's like sandpaper. Eventually it's gonna be smooth, right? And
Right.
unfortunately that wears away at the enamel on the interior, but externally you need those rough surfaces to eat. That's how you eat steak and apples and that kind of stuff. So eventually grinding your teeth will wear down at the top bone, which is what your teeth is made out of, which your teeth aren't made out of, I'm sorry. So I'm gonna have you try something out. This one is disposable. I will send it home in your care package, but I will also give you a prescription to buy one that's kind of pre-molded, so it's similar to this one but a little more comfortable, and if you wanted to, you could always come back and we could have you custom fitted for one that would be permanent. Okay,
Okay, cool.
so I'm going to try this on the top and the bottom. This is our standard size. This is just going to help me see what size prescription I need to get you. So open your mouth for me. I want you to bite down. One more time. Bite down. Close your mouth, just kind of naturally as you would in your sleep. Is that super uncomfortable? Does it feel too tight, too big, too loose? Does it feel like you're gonna swallow it?
It's not bad.
Feels okay.
Yeah.
Okay. Open for me. Now flip that over. Maybe a little too big for your bottom. What do you think?
A little bit too big.
Too big, right? You feel loose?
Yeah.
It's definitely too big. Okay. So it looks like we can go with the standard for your top, and we'll get you fitted with a small for your bottom, and I will send you home with those today. And then aside from that, I'm gonna go in with a couple different kinds of flossers here. So open for me. Like I said, it's important to brush at least twice a day, at least. Ideally you can brush after meals. Big meals, I'm not saying if you go in and take a bite of peanut butter or something, you need to go brush your teeth, but after breakfast, lunch, and dinner, if you can. Do you feel any pain with this?
Mm-mm.
And then flossing definitely needs to be done at least once a day, preferably at night after you've had your last meal. And a lot of people tend to think that you want to floss after you brush your teeth, but you actually want to floss first. And that's so if you have any built up food between your teeth, it can be removed so that you're brushing properly and the food isn't impacting how deep and how far your toothbrush can go. So in the order of oral care, just moving to the top here, you want to, if you're using mouthwash, especially a non-whitening mouthwash, which would be your regular antiseptic like Listerine or whatever brand you prefer, you want to use that first actually. So a non-whitening mouthwash you want to use first. So you're going to gargle with your Listerine for 60 seconds. You're going to floss your teeth. After you floss, you're going to brush. And then after that, if you want to go in with a whitening mouthwash, which isn't necessary, but it is your choice, you want to do that last after you've done those other 3 steps, okay?
Mm-hmm.
And this is going to be your most effective way of cleaning your teeth. Sounds like a process, but once it becomes a habit, it's really not that bad. So the next thing I'm going to go in with is a silicone flosser, and this one will be a little more uncomfortable, so let me know if it hurts. Sorry. This one really pushes on the gums, but it also kind of helps me see how tight your teeth are, which the bottom teeth actually look like they're pretty tight. Obviously that top one, no issue at all because you've got that gap. Okay, top teeth look healthy. I'm just gonna take my gauze. Clean some of that up for you. And then to take home with you today, like I said, I have a little care package. So I have some toothpaste that I really recommend actually. It's the Scope Plus. So it's gonna help you with a little bit of that whitening, but it also has the Scope mouthwash in it, which is good. So I do recommend using a regular mouthwash, but this is just kind of help you out a little bit. Has your standard soft toothbrush. Don't recommend using anything harder than a soft. I know people like to go for the medium. You really don't need it. If you're brushing your teeth as frequently as you should be, you shouldn't need anything more aggressive than a soft toothbrush. If you start to feel after 6 months or so that your teeth don't feel that clean, that's because it's time to come in for a cleaning, okay? You can only do so much with the toothbrush. You don't need to be going in with like a boar bristle brush or a charcoal toothbrush or anything crazy, okay? Soft toothbrush is fine. And there's also an antiseptic cap on here, which I do recommend using, especially because I assume you keep your toothbrush in the bathroom.
Right.
Poop particles go a lot further than you think. You really want to have your toothbrush covered, okay?
Okay.
In something preferably with holes like this so that it can dry and it's not staying wet and trapping bacteria. You don't want to put it in one of those containers that completely closes because there's no airflow.
Okay.
Okay? Want to switch that toothbrush out at least every 3 months. Once every 3 months. You can use mechanical toothbrush. You can use one that plugs in. You can use one that vibrates. As long as you're doing it as frequently as you should be, they all work pretty much the same.
Okay.
Some of the new ones that are coming out are more dentist recommended, like the Sonicare and things like that you're welcome to try. They are a little more expensive, but for day to day, you should be fine with just a regular old toothbrush, okay?
All right.
Okay, so just to kind of help you out a little bit with some of that swelling that can happen from the lidocaine, I am going to do just a light wrap. I want you to leave it on for 20 minutes and then you can take it off, okay?
Thank you.
So, go in here. I'm going to do it too tight. Can I have you lift your head for me? Okay. Go ahead and relax. Okay, like I said, 20-25 minutes and you should be good to go. You can go ahead and take that off. If you need to, you can apply a little light ice, but I don't think you'll need it. If nothing else, you can take a low dose Tylenol, okay?
Okay.
All right, James, well, thank you so much. Go ahead and check out with the receptionist. I do recommend scheduling your 6-month appointment ahead of time. We do book up kind of quickly, and I think that would help get you in faster, okay?
All right. Thank you.
All right, thank you. Have a nice day.
Thank you.